So, which doctors get paid the most? In this video today, we're going to talk about that. What's up everyone, this is Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. So, a recent Medscape physician compensation report, this is for 2019, that just came out that talks about which physicians earn the most. And I get a lot of questions about this from students out there that are asking, like, who makes the most money? Which specialists or which doctor makes the most money? And I think this is something that is really important because how much medical school costs these days, the tuition. The average medical student will come out of medical school with about $200,000 to $250,000 in debt. So I think it's important, and even though money may not be the sole reason why you do this, but it is something that you have to think about. Just because if you go into debt, let's say $250,000, and then you go into a specialty like, let's say, pediatrics that earns $100,000 per year or $150,000, well, that may be really challenging to pay off when you have to pay for rent, transportation, food, other credit cards, living. You know, it's going to be really hard to pay that off. So this report that just came out, they actually interviewed more than 20,000 or surveyed more than 20,000 physicians in more than 30 specialties who responded to this in terms of their salary, number of hours worked, how much time they take to see patients, and what do they find most rewarding as well as challenging about their jobs. So, on average, when I ask these 20,000 physicians how much do they earn, the PCPs or primary care doctors on average $237,000, the specialists $341,000. Now, I know I'm going to get a lot of comments below or emails and say, hey, you're wrong. This physician here, this specialty doesn't earn the most. I have a family friend who earns $2.5 million in Idaho. Well, every specialty is different. Every contract is different. It depends on whether you're private practice or academics. And academics means you work at the med school, you do some teaching, you have a professorship kind of title that that you have. It depends on a lot of things, whether you have investments in surgery centers, ancillary, such as if you own a physical therapist company, equipment company, or DME, which is durable medical equipment. It depends on a lot. So just because there's one, let's say a pediatrician who earns $10 million per year, well, that is just an outlier. When they come up with reports like this is a kind of across the board or the median, what the average doctor makes. There are some pediatricians who earn more probably than orthopedic surgeons or more than neurosurgeons because maybe they own the building that they're working in, or maybe they own the practice and have 10 other people that work for them. So there's a lot that comes into this. Also, where you live. Physician salaries in California are usually lower than other salaries that are in the north or kind of the East Coast, just because everyone wants to live in California. So it really depends. So on average, specialists $341,000 per year, primary care doctors $237,000 per year. When looking at the average annual physician compensation, orthopedics tops the list. And one critique about this is that the neurosurgeons didn't respond to this, or they don't have the data for that. But the neurosurgeons will probably be right at the orthopedics, kind of 482 or actually higher than that. And just from interviewing recently and meeting with different groups and about to go out into practice, I know this number is really low compared to the figures that I have seen and talked to different groups about. I would say for a orthopedic spine surgeon, the average salary, depending on where you are, it's around $600,000, $700,000, $800,000 a year, kind of starting off. So, and every group is a little bit different. Every job is a little bit different, whether you start off a little bit lower or you start off a little bit higher. So, orthopedics and cardiology on this list kind of top it, and every report for the last 5 years, they have done that. So primary care physicians, who earns the most, men versus women. You can see there's a discrepancy there, which should not be there. Everyone should be making about the same. When looking at the hours per week seeing patients, the primary care physicians usually around 35 to 40 hours, which is pretty average. How much hours per week do you spend on paperwork and administration? And even though when people think, oh, I'm seeing patients in clinic or the ER or the hospital for, let's say, 40 hours per week, well, as a doctor, you have a lot of other responsibilities, including paperwork, billing, coding, and these things do take time. And then 36% of people spend 20 hours or more a week for paperwork, which is ridiculous. So who earns more, employed or self-employed physicians? When you look at self-employed in general, they usually get paid more. You get a lot of more tax benefits being a 1099 versus a W-2 or W-9 employee. So $359,000 versus $289,000. Self-employed physicians tend to earn more. If you think about private practice, that's more of your self-employed versus working at an institution like a medical school. That's more an employee or an employee of a hospital, which they pay you directly. Self-employed physicians, what percentage of your revenue went to overhead? And this is something that they don't teach us along this path. When you get out into practice, and say for instance you're going to join a group of other doctors, let's say your specialist is nephrology, well, you're going to go out into practice and you're going to join a group of doctors, other nephrologists. And in this practice, each month, you're going to have to pay overhead. And this includes your office staff, the papers that you use, the printers, the office space, the billing. You have to pay for these things. And from my kind of research and talking to different groups for orthopedics, the average overhead at groups that I have met with have been anywhere between $30,000 to $60,000 a month. That means whatever you do in surgery, clinic, ER, you have to at least make, let's say, $50,000 a month before you start making money. You have to pay the light bills, the employees, all the equipment that you have, the debt from, buying things and on loan. So a lot of people don't think about this, and a lot of people don't know this until you're starting to look for a job. But overhead is something that it can be a really nerve-wracking, thing for a lot of people out in practice, just because it's a lot of money. You have to be able to produce this much to be able to take something home. So the owners are in solo practice, about almost 50% of their revenue went through overhead. So if you make $1 million, $500,000 of that is going to overhead. And then you still have to pay taxes on that $1 million. So that's another $400,000. So out of $1 million, if 500,000 is going to overhead per year, another 400,000 is going towards taxes, well, you're left with $100,000. So the fact that, a lot of people think that doctors make a lot of money, we do, but, we spend a lot of money as well. If you're in a group, about 46% of the revenue was going to overhead. So keeping overhead low plays a key role in determining how much or how profitable a practice is. And overhead varies by specialists, primary care physicians, how many people are in your group, what side of town you're on, how many offices that you have, how many employees. So that kind of varies widely. So the top earning states for physicians overall: Oklahoma tops the list. You have Alabama, Nevada, Arkansas, Florida. I was quite shocked not to see that Texas wasn't on that list. I think people in Texas, it's actually a great place to practice medicine. Do you use PAs or nurse practitioners in your practice? Most people use nurse practitioners. Some people, it says neither, but we as surgeons, we utilize PAs more. That way we can bill for them in surgery. We can utilize those people in surgery. So most surgical subspecialists use PAs or nurse practitioners in their office. So which physicians feel fairly compensated? Emergency medicine doctors, I would imagine, just because they have a lot of time off. Dermatologists, really cush lifestyle. Radiologists, orthopedics is up there, but not kind of at the top. Family medicine, I was, quite shocked to see that 53% of family medicine doctors feel like they're fairly compensated, which, and they don't have the highest salary. So when they ask what is the most challenging part of the job, most people would say that there are lots of rules and regulations, and I kind of agree with that. In terms of paperwork, the politics of medicine, everything that we go through with insurance companies and denials and trying to fight for our patients, there's lots of rules and regulations that can be very stressful for the physician. There's also noted that EHR systems having to work long hours as well as getting fair reimbursement, and I kind of agree with that. But the most rewarding part of most people's jobs who filled out this survey was the gratitude and relationships with patients. I definitely agree with that. That there's really no other job that can give you the gratitude and gratification, from doing something that we love to do. And this is primarily because most people go into the field of medicine not because of the money, but to help people. And once you're able to do that, that is very gratifying. When asked, would you choose medicine again? 84% of ID doctors, as well as cardiologists, nephrologists, orthopedics is like 82%, say that they would choose medicine over again. The lowest ones were plastic surgery. I was quite surprised by that, as well as PMR doctors. And I've seen a lot of stuff lately about the burnout rate and frustrations that PMR doctors are having. 62% of people say that they would choose medicine again. So you have almost 40% of PMR doctors that I wouldn't do this again, which is really interesting. Would you choose the same specialty again? And at the top of the list was ophthalmology. Orthopedics was number 2 at 95%. GI doctors was number 3, and then dermatology at number 4 at 92%. So that is very refreshing to see that most orthopedic surgeons would choose the same specialty again. If you look at the bottom, family medicine, internal medicine, those people state that they, would not choose the same specialty again. And that's probably because of, too many patients to see in a short amount of time, as well as, the low kind of reimbursement rate, compensation rate for, primary care doctors, which is extremely sad, especially in this country where we need more primary care doctors. So this was a really good survey, the physician compensation report for 2019. Downside of this, it didn't include neurosurgery. It would be interesting to see the neurosurgeon's salary and how they relate to everyone else, as well as how many hours they work. Would they choose neurosurgery again? And, just to have that kind of comparative specialty kind of to ortho spine. So what do you guys think? Do doctors get paid enough? Are we compensated well enough compared to the number of years that we go through for training, as well as the large investment of tuition for medical school? So do we get paid enough? Put it in the comments below. I would love to hear from you. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. We'll see you next time.